A major ruling from a federal judge tonight that gives the company that provides health care to Arizona inmates 3 years to comply with a settlement stemming from accusations of lackluster care. And I want to show you what's on Corizon's website. The company says that it provides high-quality care that will improve the health and the safety of our patients. It goes on to say that our people, our practices, and commitment to success through evidence-based medicine enable us to consistently meet and exceed client expectations. But several nurses who currently work for Corizon say that is not true. And one family we spoke to says that their father died because Corizon failed to live up to its promise.
He was always in great shape. He walked all the time. He actually walked quite quickly.
Mark Dehe spent as much time as he could with his father, Manfred, before he was sentenced to 10 years in prison. Little did he know what 3 years living inside an Arizona prison would do to his father.
Infuriating. Infuriating.
Soon after Manfred was in prison, he complained to his family that he was in pain. His son, at first, ignored him.
I thought he was overreacting, and I told him, Dad, you know, this isn't the Ritz.
Medical records show on February 21st, 2012, a prison doctor recommended surgery for a hernia. Priority, urgent. On March 13th, another medical professional recommends Manfred be seen by a doctor outside the prison, again for hernia issues. 1 week later, medical staff again recommends outside treatment. Priority, urgent.
There are people out there who will say these are some of the most violent criminal offenders. Who cares what kind of health care they get?
I'm a little embarrassed to say I understand. Prior to my father going to prison, my thoughts were that, well, if they didn't do anything wrong, then they wouldn't have been in that position to begin with. But I also assumed that they were receiving and given adequate health care.
These are Manfred's handwritten notes to prison staff, where he appears to be begging for help. I'm 77 years old. I don't feel right. I'd like to have a doctor fully examine me. To urinate is extremely painful. My hernias are also hurting. I'm not receiving any more meds for my urinary tract infection. When Manfred is finally seen by doctors outside the prison walls, lab tests came back with devastating results.
Prostate cancer, terminal prostate cancer, stage 4.
Manfred's health deteriorated fast. He was supposed to receive monthly injections to slow the cancer, but medical records show that injections were sometimes missed because the medicine was not available.
And from that time until he was finally seen for an exam, August of 2013, 15 months had passed, and by that time it was too late. After only approximately 2 weeks, he had severe bed sores. They would eventually get so bad you could even see through to the bone.
Sadly, Manfred's story is not unique. The state of Arizona has a contract with a private healthcare company, Corizon, to provide care for inmates. A report by medical experts hired by the ACLU to inspect and review the conditions at Arizona prisons found almost half of the people who died natural deaths received grossly deficient medical care, and that the poor care clearly caused or hastened their death. We even spoke to a current prison nurse who confirmed that inmates are dying because of poor care.
People with ongoing diagnoses like leukemia or diabetes or complications to some serious illnesses that need to be seen by outside consults.
You're saying some of those patients are just being delayed care?
Absolutely.
Nurses and doctors caring for Manfred tried to get him proper care. A doctor examined him and wrote to prison management that, quote, "It is my medical judgment that this patient requires hospitalization." One nurse even wrote this note saying, quote, "Department of Corrections short-staffed and unable to provide security for ambulance transport. Consult canceled."
Do you believe that when he was sentenced to serve time in prison, he was in fact sentenced to death?
Yes. He was ridiculed by the staff One of the people even joked around, why don't you throw a sheet over him? You know, kind of insinuating that he smells like he's dead, so he must be dead. Just cover him up.
Corizon just settled a major class action lawsuit promising it will make changes to provide better care to inmates. That case settled on October 14th, the same day Manfred lost his battle to cancer.
Do I think anything's going to change? Not a bit. Not a bit. They act on the fact that there is no oversight, and therefore they can do whatever they want. And who's going to complain? The inmate? Who's going to believe the inmate?
And by the way, we want to say that we reached out to the Department of Corrections for an on-camera interview. A spokesperson told me that by law they can't talk about individual cases, but says that they do monitor inmates' health care and changes are being made to improve the system. Corizon also declined to talk to us on camera. We did, though, receive this statement from a spokesperson this afternoon, saying that the care provided to inmate Dehe from the time Corizon Health began serving the Arizona prison system met the standard of care and was appropriate to his condition. Federal and state privacy law prohibit public discussion of details of patient conditions of courses of treatment.